Hello, how are you?
I'm good. How are you?
I'm good. I'm gonna close this with privacy. My name is Allie Weaver. I'm gonna be your nurse today. So I'm gonna wash my hands real quick, okay? So I'm gonna wash my hands. Okay. Alright. Can you tell me your name and date of birth?
Chanel Sproul, 429.99.
Okay, thank you. So I just want you to know, or today we're going to be doing your physical assessment, and I just want you to know that everything we do in here is confidential, and you have the right to refuse anything that we do, okay? So, Ms. Sproul, can you tell me where you are?
At MUW Hospital.
Okay. Can you tell me what day it is?
It is Thursday,
And can you tell me what year it is?
2022.
All right. Can you raise your right arm for me? Okay. So patient is awake, alert, and oriented ×3. Her speech is appropriate for her age, and she's able to respond to verbal commands. Okay, so first I'm going to test your eyes, or look at your eyes, all right? With my pen pad, look at your pupils, just look right at me. Okay. Pupils are a 4 in both eyes, 4 millimeters in both eyes. They are symmetrical. And yes, okay, I'm gonna dim the lights and I'm gonna test your pupillary response, okay? So I'm gonna shine this bright light in your eye, just look right at me. Okay. All right. So pupils reacted to the light in both eyes, direct and consensual responses. So can you look at this wall for me and just focus on it? And now focus on my pen light. Okay, so pupils are perla. They are equal, round, reactive to light, and accommodation. Okay, now we're going to test your eyes on the Snellen chart. So do you mind following me out here? Okay. So you stand right here. I'm assessing the patient's gait. It is steady and normal, okay, or just steady. All right, so patient is sitting 20 feet from the Snellen chart, and we're going to test her visual acuity. All right. So with both eyes, do you have any corrective lenses in today? No. No? Okay. So with both eyes, can you read this chart for me?
E.
All right.
FP. TOZ. LPED. PEC. FD. EDF. CZP.
Okay. So patient has 20/20 vision in both eyes. Now can you cover your right eye for me and read this?
E. FP. TOZ. LPED, PEC, FD, EDF, CZP.
Okay, so patient has 20/20 vision in the left eye. And now can you cover your left eye for me?
E, FP, TOZ, LPED, PEC, FD, EDF, CZP.
Okay, so patient has 20/20 in the right eye as well. Okay, so let's go back into the exam room. Okay, I'm gonna close this again. Okay. So now I'm going to look at your ears, okay? So I'm just gonna look and assess or inspect them. So there is no lesions, no drainage present. She has one earring in both ears. No drainage or lesions present. Skin is appropriate for race. No bruising, no scars or anything, okay? So your ears are in line with the outer canthus of both of your eyes. So they are symmetrical. And now I'm going to look at your nose, okay? So I'm gonna inspect it first. It is symmetrical, it is midline, your septum is midline. Do you mind leaning your head back for me so I can look in your nose? Okay. So her nasal mucosa is pink and moist. There are no lesions present. Her septum is midline, and her turbinates are present. So yes, okay. And can you open your mouth for me? I'm gonna look inside your mouth. Go ah.
Ah.
Okay. So her buccal mucosa, or the inside of her cheeks, they are pink and moist. There are no lesions present. And the top of her mouth, there are no lesions present, and it is also pink and moist. Can you stick your tongue out for me? Tongue is midline, pink and moist, no lesions present. Can you raise your tongue? Okay, her frenulum, there are no lesions present in her frenulum. pink and moist. Can you stick your tongue out for me and go, ah? Okay. Her uvula is midline and it rises with phonation. Her tonsils are a grade 2. And can you smile for me? Okay. Her teeth are all present. No caries seen or noted. Can you raise your top lip for me so I can look at your gums? Okay. Her gums are pink and moist. No lesions. Bottom lip. Okay. Gums are pink and moist. No lesions. Now, do you mind if I test your gag reflex?
Not today.
Okay, so the patient has deferred the gag reflex, but what I would do is I would take a tongue blade and I would push it down on the back of her throat and it would elicit a gag reflex on the back of her tongue, not her throat. All right, so now I'm gonna look at your neck, okay? So I'm gonna just inspect it first, okay? There are no lesions, no discoloration, it is intact, dry, symmetrical. Okay, now I'm going to inspect for pulsations. Okay, so I'm just going to look and see if there's anything pulsating in your neck. Okay, slight pulsations are present. Now I'm going to palpate your carotid artery. So I'm going to feel your artery with my finger. Okay, and I'm going to count. Count for a full minute. Okay, so her pulse is a grade 2 plus. Okay, her other pulse is a grade 2 as well, and I would also count for a full minute, or 15 and times it by 4. Okay, now I'm gonna auscultate. So I'm gonna listen to your carotid. Okay, so I'm just gonna hear if I hear any, or see if I hear any swishing sounds. Okay. So I'm going to use the bell of my stethoscope to do that. Okay, so can you hold your breath for me? Okay, you can breathe. One more time, hold your breath. Okay, no bruise present. Now I'm going to inspect the back of your body, okay? Thank you. Okay, so I'm inspecting the back of her body. Her body is symmetrical. Her skin is intact, and the color is appropriate for her race. I notice no lesions, no scars, and no abnormalities or no skin issues on her back. Okay. So now I'm going to palpate your back. So please let me know if you feel any kind of tenderness, okay?
Okay.
Any tenderness?
No.
Okay, so patient notes no tenderness in her back. All right, now I'm going to auscultate your breath sounds. I'm just going to listen to your lungs, okay?
Okay.
So just breathe normally. Okay. Can you take a deep breath for me? Okay. Remove your bra. Okay, one more time. And one more time. Okay, so no adventitious breath sounds heard. Breath sounds are present. Okay, now I'm going to percuss for CVA tenderness. Okay, so I'm going to feel down her spine and I'm going to find her last rib. Okay, it's right there, so I'm going to go right up under it and I'm going to find that angle right there. Any tenderness?
Mm-hmm.
Okay, so I'm going to go down her spine, find her last rib. It's right there, so right up under it. Any tenderness?
No.
Okay, so no tenderness noted in this costovertebral angle. Now I'm going to move to the front of her body. Okay, so her anterior chest is symmetrical. Her chest wall is expanding and contracting as it should, symmetrically. And now I'm going to count her respirations, and I'll count that for a full minute. So. Okay. So her respirations, she has no trouble breathing or no, I guess, work of breathing issues. So her chest rises and falls as it should. Okay, now I'm going to listen to your breath sounds, okay? And I'm gonna use the diaphragm. Take a deep breath for me. I'm gonna go right up under your brow. Is that okay? Okay. Okay. So no adventitious breath sounds heard. Breath sounds are present. Okay. Now I'm going to auscultate your heart. So I'm going to listen to your heart. Okay. So I'm going to start by using the the diaphragm of my stethoscope. Okay. I'm gonna go right up under your brow. Is that okay? Okay. Okay. So S1 and S2 were noted, and she has no additional heart sounds and no murmurs. Okay. So now I'm gonna use the diaphragm on my stethoscope and listen one more time. Okay. One more time. Okay. So S1 and S2 were also heard with the bell. She had no extra heart sounds and no murmurs present. Okay, so now I'm going to palpate your apical pulse. Do you mind laying down for me real quick? Okay. So I'm gonna first I'm going to auscultate it, and I'm gonna count it on my watch. Okay, so I would count that for a full minute. All right, now I'm going to feel your apical pulse. Okay, count it for a full minute as well. Okay, so her pulse is a 2+ in the apical pulse area. Okay, do you mind sitting back up for me? Okay, now I'm going to test your strength, okay? So I want you to start by squeezing my fingers. Okay, thank you. Now, can you put your hands together and spread your fingers for me? Okay, good job. So her strength in her fingers is a 5 out of 5. Now I want you to do this with your arms, and I want you to pull against me. Good job. Now push. Good job. So her arm strength is a 5 out of 5. Now I'm going to do your shoulders, okay? Can you shrug your shoulders for me? Good job. So her shoulder strength is also a 5 out of 5. Now I'm going to test your radial pulses, okay? So if you mind flipping your arms over for me, I'm going to put my fingers right here. I'm going to count them. Okay? So I would count for 15 seconds and times it by 4. Her pulses are equal bilaterally, they are grade 2+, okay? Now I'm going to count your brachial pulses, okay? I'm gonna count for 15 seconds, multiply by 4. Okay, and her grade is a 2+ as well in both arms. So now I'm going to test your capillary refill, okay? So can I see your pinkies? Thank you. Okay. Thumbs. Okay, so our capillary refill is less than 2 seconds. So that is great. That means that she has adequate blood flow. Okay, now we're going to do range of motion, okay? So if you could just straighten your arms out for me, put them above your head, okay? Bring them down, bring them behind you. Good job, okay? And if you want to stand up for this, you can. That way it's a little bit easier, okay? Now can you flex and extend? So do what I'm doing. Extend, okay? Wrist up, down, fingers, wiggle your fingers, okay? Do this for me. Okay, and just wave. Good job. So she has full range of motion in the arms, wrist, hands, fingers. Now we're gonna do abduction and adduction. So you go like this for me. Okay, bring it down. Okay, go like this. Right, and this. Good job. Okay, so she has full range of motion in her shoulders as well. Okay, so can you sit back down for me? Thank you. All right, so now we are going to assess her abdomen. Okay, so do you mind laying down for me? Okay, so I'm gonna first inspect her abdomen. So I notice no lesions, no scars, and her skin color is appropriate for her race. Her umbilicus is midline, and now I'm gonna check at eye level for pulsations. Okay, I notice a slight pulsation in her abdomen, and now I'm going to auscultate her abdomen. Okay, so I'm going to listen to your stomach and listen if I can hear any sounds. Okay, I'm going to use the diaphragm. So her bowel sounds are all present, and she has normal active bowel sounds. Now I'm going to palpate, okay? So I'm just gonna feel around on your stomach. Let me know if there's any, if you have any tenderness or aches, okay? Okay, so I'm gonna lightly palpate first. Okay, any tenderness? Okay. Okay, so no tenderness in the light palpation. Now I'm gonna deeply palpate, so I'm gonna go a little bit deeper on your stomach, okay?
Okay.
Let me know if you feel anything.
No.
Okay.
No.
Okay.
No.
Right.
No.
Okay, so the patient noted no tenderness, and no masses were felt, and no abnormalities in this, or no masses or any palpable masses were present in her abdomen. So do you mind if I palpate your femoral pulse?
Not today.
Okay, so if you were to do this at home, you would go to your groin, you would take 2 fingers in your groin area right at the bend of your leg, and you would push down and you would palpate that, okay? And you would feel a pulse right there, okay? So now I'm going to inspect her legs, okay? You can pause and start it. Okay, so now I'm going to inspect your lower extremities or your legs. All right, so I'm just looking for any abnormalities. She has no lesions. She does have a couple bug bites, and she has a tattoo on her right upper leg and her right calf as well. Her hair distribution is not present because she's a female and she shaves. So, but she does shave her legs, so we know that it is there. now I'm going to test, or she has no varicose veins either, in either leg. You might have a look behind your legs. Okay. Okay. I'm gonna come to this side for this. Okay, you lift your leg for me. Okay, no varicose veins present. Now I'm going to feel her skin temperature, okay? So I'm just gonna feel my hands on your legs. Okay, so her skin is warm and intact. It is the appropriate color for her race. And now I'm going to assess for edema, okay? So I'm just gonna push down on your legs. Let me know if you feel any pain, okay? So I'm gonna push down for 5 seconds. Okay, her edema grade is a 0. All right, now I'm going to feel for her popliteal pulses, okay? So do you mind bending your legs for me a little bit? Thank you. I'm just gonna feel right up on your legs for a pulse, okay? Okay, I'm gonna count it. Okay, and I would count for 15 seconds and multiply by 4. Okay, we will say her pulse is a 72, okay? And it is a 2+ grade, okay? Now I'm going to feel your posterior tibial pulses. So right behind this bone of your foot, on the inside, I'm gonna feel for it, okay? Watch her out. Okay, and I'll count for 15 seconds and multiply by 4. So it is a 70, okay? And it is a grade 2, 2+. All right, now I'm gonna feel for her dorsalis pedis pulses, or pedal pulses. Now I count for 15 seconds, multiply by 4. Okay, her pulses are a grade 2, and they are also 70. And now I'm going to test her, or actually I'm gonna inspect her toes, okay? So I'm gonna look between each toe, okay? I'm just gonna make sure there's nothing in here. Okay. Look at the bottom of parts of your feet. Okay. I'm gonna switch between these toes. Okay. And look at the bottom of these feet. Okay. So there's no skin lesions in between the toes, and no lesions on the bottoms of her feet either. And now I'm going to test your capillary feel. Okay. So I'm just gonna press on your toes and see that the blood comes back. Okay. Okay, so our capillary refill is less than 2 seconds in all of her toes. Okay, do you mind swinging your legs out to the side for me? Do you mind sitting up for me? I'm sorry. And swinging your legs out to the side of the bed. Thank you. Okay, so now I'm gonna test your strength in your legs, okay? So what I want you to do is I want you to pull your legs back against my strength. So pull back, okay? Now can you push towards me? Good. Now can you push your toes up? Okay, and down. Okay, can you wiggle your toes for me? Good. All right, can you pull your knees up? Yeah, yep, just straight up. There we go. All right, so she has full range of motion in the legs. I'm sorry, her strength in her legs is a 5 out of 5 for her knees, ankles, and toes as well. Okay, and now I'm going to assess her range of motion. All right, so do you mind laying down for me again? Thank you. Okay, can you swing this leg out for me? Okay, and this leg out for me and back in. All right, can you bring your knees to your chest, or one knee at a time? Okay, the other one. Good. So she has full range of motion in the hips. Actually, can you bring your knee forward for me and turn it inwards? Good job. And down. The other one and inwards. Good job. So she has full range of motion in the hips and knees and legs. Okay, can you point your toes for me? Can you bring them up? Good job. And wiggle them one more time. Can you bring them inwards and outwards? Good job. So she has full range of motion in her ankles and her toes and her hips and her knees and her legs. Okay, and now we are going to assess your spine. Okay, so do you mind standing up for me? Okay, can you bend over and touch your toes, or act like you're touching your toes? I'm gonna raise your shirt, okay? Okay, so I'm gonna check her spine. Okay, her spine is midline, and I see no lateral curvature of the spine, so that that means that she is a negative for scoliosis. Okay, I'm gonna pull your shirt back up. You can stand back up for me, okay? And you can sit back down. And that completes our assessment. Thank you.
Thank you.